Dear colleagues, I'm Desiree Wussler from Department of Cardiology and Cardiovascular Research Institute in Basel, and I welcome you to my presentation about the incremental value of C-reactive protein to the MEESSI acute heart failure risk score. The MEESSI score has high accuracy in the prediction of 30-day mortality in patients presenting with acute heart failure, and therefore may be considered the current gold standard for this indication. As the original MEESSI model does not include measurements of inflammatory biomarkers such as C-reactive protein, the purpose of this study was to assess the incremental value of C-reactive protein to the original MEESSI model. In a prospective multi-center diagnostic study, the presence of AHF was centrally adjudicated by 2 independent cardiologists, and the MEESSI acute heart failure risk score was calculated using a recalibrated model containing 12 independent risk factors. The incremental value of C-reactive protein was examined by the use of a logistic regression analysis, and goodness of fit tests were performed to measure the model's discrimination and calibration. Among nearly 1,600 patients with adjudicated acute heart failure, 1,200 patients had a complete data set allowing the calculation of the MEESSI acute heart failure risk score updated by C-reactive protein. As you can see by the figure on top, the C-statistic of the MEESSI model updated by C-reactive protein of 0.83 was significantly higher as compared to the C-statistic of the original MEESSI model of 0.79. In addition, when we assess the cumulative mortality, the gradient in 30-day mortality over 6 predefined risk groups was improved by the MEESSI model updated by C-reactive protein. In addition, both models, the original MEESSI model and the model updated by CRP, showed a good overall calibration as indicated by a non-significant Hochmuller-Meshov test. However, as indicated by the calibration plot on the bottom, the calibration curve of the MEESSI model updated by C-reactive protein was improved as indicated by the calibration curve shifted closer to the line of ideal calibration. These findings were confirmed in a sensitivity analysis that used multiple imputations for MEESSI values in the overall cohort of 1,600 patients. To conclude, there is a significant incremental value of C-reactive protein to the MEESSI acute heart failure risk score as indicated by the improved goodness of fit compared to the original MEESSI model. I thank you for your attention and I'm open for questions.